Hello, my name is Peter Terrace, and today we're going to be looking at the correlation between positive test results for COVID-19 with ICU bed usage in the Niagara region. And we're going to be using the data that Niagara Health has provided at the niagararegion.ca. They've done an amazing job collecting this data and compiling it here on their website at niagararegion.ca. So I'm just going to be basically going through this data with you as I'm talking about it. And what I guess full disclosure, I am not a doctor, I'm not an epidemiologist, so if I misrepresent anything that I'm saying here today, I welcome your comments and I welcome any correction that you may have. And also, I guess the other thing I just want to state to preface the discussion is that these are actual people that we're talking about in the ICU that need our prayer and compassion. So as much as I'm talking about just facts and numbers, these are actual people who are in ICUs. So we just have to be mindful of that as we discuss these facts. Okay, so we're going to be looking at the cases by certain dates in time. And we're going to just compare at those times. We're going to be comparing December 1st with December 31st and January 31st. On December 1st, we have 2,161 cases. And so I'm finding that information from this great graph where I can just hover along the x-axis and I can move along in time to whatever date I want to move to. And on the y-axis, we have the logarithmic scale of the total number of cases. So on December 1st, we had 2,161 cases. We can hover over to December 31st. We have 3,946. So for December, there was a net increase of total positive cases of 1,785 people. And just also, this graph does not capture people who were positive for COVID-19, who had COVID-19 but didn't actually test positive. Anecdotally, we know a lot of people have said, oh yeah, in February I was feeling so sick, I'm sure I had it back then. Or people that, there was one doctor that I can't remember who it was, so I can't give him credit for this. He said that this disease is so dangerous that you may not even know you have symptoms. I don't know how that works out. Like I said, I'm not a doctor, so that just doesn't make sense to me. But anyway, that's what we've been told. So a lot more people than this may have had the disease, but aren't going to be reflected in this graph. We're going to move to January 31st, and we see that there's 7,881 total cases. So for January, there was a net increase of 3,935 positive test results for COVID-19. So we're going to scroll down now. This is on the same page. They have a lot of great data on this website page. But we're going to scroll down, and we're going to scroll down to percent of intensive care unit beds occupied. And we're going to look at December 1st. December 1st was the day that we looked at, and we saw that there was a certain number of positive cases, but there was a 220% increase month over month from January to December. So a 220% increase in positive test results, and let's see if that translates into a proportional increase in the number of ICU beds being occupied. Because when we went into this in the beginning of March, when we were told that we have to lock down in order to flatten the curve, and then later we were told, no, well, actually, yes, it's to flatten the curve, but also to make sure that the ICU beds aren't overrun, because our hospitals are going to be overrun. So there's a lot of fear-mongering going on at that time, that they were saying that the politicians were telling us that, well, actually, if you don't listen to us, people may be dying at home because we won't have room in the ICUs. And so there's a lot of this fear-mongering in order to control the population to abide by what they're telling us. So let's look at December 1st. 84.4% of ICU beds were occupied. And then we move along in time along the x-axis. We got a little dip here. Let's see what this is all about. December 24th and December 25 coincides with Christmas. Okay, why would that be? I don't know. Whatever. That's what we're just going to move on. I can't figure that one out. And then we go to January 1st. Okay, so January 1st, 76.6% of beds are occupied, intensive care unit beds are being occupied. And then we move along in January, and there doesn't seem to be a significant increase. Like you'd expect that the positive test cases, has been the rationale all along for the lockdowns. As we have more positive test cases, we have to lock down. We've been told we got to get the positive cases down. We got to stop infection. Infection seems to have nothing to do with people being admitted to ICU, because if you test positive for COVID-19, you're going to end up in ICU in the next few days after a positive test result if you're going to get that sick. And we don't see that here. So there's no correlation that I can see. Like I said, I'm not a health professional. There's no correlation that I can see from a 220% increase in positive test results to ICU bed admittance. And if I'm running, I guess just another thing I wanted to say about this particular graph here, if I'm running a healthcare system, or if I'm a doctor in charge of a healthcare system, I want to be running my system at 80 to 90% capacity. Like if I have an ICU that's 50% full, then I'm doing something wrong. I'm misallocating my resources. I should be doing a better job allocating the resources so that I'm 80 to 90% at capacity. And actually I should have a system that's adaptable, that if there is a spike or if there's a major disaster, we can quickly add more beds. But if I'm running a hospital that's at continuously 50% capacity, I'm doing something wrong. And at the beginning and we're going to move down to the graph below that looks at percent of intensive care unit beds with ventilators occupied. This was another thing that was, another statement that was being made back in March of 2020, that the reason we have to lock down is because we don't have enough ventilators, and we have to make sure we get enough ventilators in our hospitals so we can accommodate for all the people that are going to get sick. So again, the x-axis is time, the y-axis is percent of unit beds being occupied. Okay, so here in June 28th, we show that 45.5% of beds with ventilators were occupied. As we move through time, we're looking at like 20, 25%. There's certain spikes here, 45% of unit beds with ventilators that are occupied. There's never been a shortage of ventilators. And there's never been a shortage of beds with ventilators at all, despite there being, and especially in January here, we see a spike of 220% in the number of positive cases, but there's no significant spike here with unit beds being occupied with ventilators. And also what we're talking about here in the number of beds in the Niagara region is a pretty small number. I mean, the total number of beds, ICU beds in all of Ontario is 2,200. So in the Niagara region, we're probably talking about, it's a fairly small number. So any one person changing, or any bed that's left unoccupied, that's going to leave a pretty big jump because there's so few beds that are actually in the Niagara region. I hope that made sense. And I hope I've done a good job explaining this, but I guess the only other thing that I wanted to say that is I think we can't use ifs, ands, buts, and maybes in order to make decisions about healthcare and our political situation. We need to use our data and some facts. So now we have, what's coming up now is the new variant. So we're saying if this new variant is as dangerous as it might be, then we could have a major disaster on our hands in the ICUs and in the hospitals. That's proven to be false. I think I've tried to prove that false right now, that in the last 2 times where they've told us that there's going to be a major spike in the ICUs, it's just not there. So now that they're telling us that this new major variant might be made very dangerous and it could be devastating, like all this fear-mongering and mass hysteria has to stop, and we need to use actual facts rather than junk science. So my name again is Peter Terrace, and thanks for joining me.